let's talk about anxiety disorders. A common characteristic of all anxiety disorders is a feeling of apprehension and anxiety. The 5 anxiety disorders I'm going to talk about are generalized anxiety disorder, panic disorder, phobias, obsessive compulsive disorder or OCD, and post-traumatic stress disorder or PTSD. Symptoms of generalized anxiety disorder are persistent and uncontrollable tenseness and apprehension, autonomic arousal, and inability to identify and avoid cause of anxiety. Autonomic arousal is something that you should be familiar with at this point. It means increased heart rate and respiration. Possibly sweaty palms and shakiness are present. Okay? Fight or flight. An important thing to remember is you can't pinpoint the thing that makes you anxious with generalized anxiety disorder. You are just anxious in general. So it can be hard to treat because of that. Panic disorder includes minutes-long episodes of intense dread, which may include feelings of terror, chest pains, choking, or other frightening sensations. These are called panic attacks. Now, you can have a panic attack and not actually have panic disorder. They can look very much like a heart attack. You might feel a tremendous weight on your chest and feel pain radiating from your chest. Unlike generalized anxiety disorder, you know what triggers your panic attacks, so you try and avoid those situations. Many of us have phobias, which are marked by persistent and irrational fear of an object or situation. You can have a phobia and not have what we call phobic disorder. Phobic disorder is more pervasive. You avoid situations where you might, say, see that object that creates that irrational fear. Say you have a phobia of snakes. Well, someone with a phobia might panic in the presence of a snake, whereas someone with phobic disorder actually changes their life to avoid snakes. Okay. There are some common phobias like a fear of heights, public speaking, and small spaces. If you go online and Google phobias, you'll find that you can have an irrational fear of just about anything. Obsessive compulsive disorder includes symptoms of persistence of unwanted thoughts, which are obsessions, and urges to engage in senseless rituals, which are compulsions. And they cause distress. People who have OCD, they want to stop these obsessions and these compulsions, but are unable to do so. Okay? So when we think about obsessions versus compulsions, obsessions are thoughts and compulsions are actions. So I might have an obsession about germs and compulsively wash my hands. Last anxiety disorder I'm going to talk about, post-traumatic stress disorder or PTSD. To be diagnosed with PTSD, you must have 4 or more weeks of the following symptoms: haunting memories, nightmares, social withdrawal, and jumpy anxiety and sleep problems. You can also see in a patient with PTSD having limited emotional expression, so they don't really react to situations like you would normally, or have excessive emotional expression, so they overreact in situations. Traumatic events trigger symptoms of PTSD. Some common ones: combat, natural or unnatural disasters like terrorism, rape, or abuse.